Hi, I'm Dr. Elizabeth Baker, foot and ankle specialist at Reedsburg Area Medical Center. Today we're going to talk about bunions, a very common condition that I see in my practice. If you have a bunion, it's often that one of your family members also has had a bunion too. Bunions come in basically 3 different sizes: small, medium, and large. And it largely depends on the angles that the bones make inside of the foot. If you have a small or medium-sized bunion, most of the time you can find a shoe that fits comfortably. However, when that bunion becomes too large or too painful and you can't find shoes that fit, sometimes you need a foot and ankle specialist like me in order to help get your foot to feel more comfortable so you can return to your activities in shoe gear. Sometimes this requires surgery. So bunion surgery requires me to evaluate certain angles that your foot structure makes. One of the angles is the angle between the first and the second metatarsal bones. If that angle is less than 10 to 15 degrees, we can usually get away with a smaller procedure that allows you to be weight-bearing after the surgery. If the angle between the first and the second metatarsal is larger than 10 to 15 degrees, we often have to do a procedure further back, which requires you to stay non-weight-bearing after surgery. Bunion surgery is really all about angles. The goal of surgery is to reduce that large bump that's pushing inside of shoes and also to realign the joint to prevent that joint from becoming damaged over time. The very simplest bunion surgery is where we simply shave off the bony bump. This is not a very common surgery that we do because it doesn't address all of those angles that we had talked about. The second size bunion or medium sized bunion procedure is called a chevron Aiken bunionectomy. For that procedure, we make a bone cut in the head of the first metatarsal to slide it over to realign that joint. At the same time, I might also take a wedge of bone off of the base of that big toe bone in order to straighten out the toe. These 2 combined procedures take a medium-sized bunion and reduce it to a very accommodative foot type. If you have a larger type bunion, we have to do a procedure called a lapidus bunionectomy. This procedure is where we move further back in the foot and we actually fuse the first metatarsal cuneiform joint. The good news is that joint doesn't have a lot of motion, so you don't really lose any type of motion in your foot. But what we do is we create a stable ray or medial column so this bunion will not recur. If we undercorrect your bunion by choosing a different procedure, it's often that bunion will come back. The lapidus procedure requires me to make an incision over the top of your foot here, clean up the cartilage that's there, and use a combination of plate and screws in order to swing this bone, first metatarsal, into a better alignment. After you've had bunion surgery, you either will be in a period of non-weight bearing or being allowed to weight bear as tolerated in a post-op shoe. Most patients require at least 6 weeks of protected weight bearing in order for the bone cuts to heal. After that, the patient will return to a regular shoe and begin to return to their activities. Sometimes it takes 3 to 6 months before there is full recovery after a bunion surgery. However, most patients find that after those initial 6 weeks, their pain is a lot better and they're feeling great about having chosen that procedure.